If you're over 60 and have started noticing a persistent itch in a specific area of your body, stop and pay close attention to what you're about to hear. This is not a simple allergic reaction or a mosquito bite that goes away after a while. In many cases, a localized, stubborn itch can indicate something much more serious, a disease so silent that many don't notice until it's too late. Yes, we're talking about cancer. Studies have shown that in older adults, a mysterious and persistent itch can be one of the very first warning signs and the most alarming part. In 99% of the cases reported, this symptom appeared before any other visible sign of the disease. Unfortunately, many people ignore it and miss the chance for early diagnosis and a better chance at successful treatment. That's why you should never dismiss an itch that doesn't go away. Tell yourself it's just an allergy, or wait too long before seeing a doctor when your body is trying to alert you. In this video, we're going to reveal the 5 areas of the body where a persistent itch may indicate cancer. You'll learn how to tell the difference between a simple irritation and a potential sign of a more serious disease. And when it's time to seek medical attention, we'll also show you how to properly communicate this symptom to a doctor so you don't waste precious time. If this information makes sense to you, don't forget to like, comment, and subscribe to the channel to get more helpful videos for those who want to age with health and quality of life. Stay with me until the end to make sure you don't miss any critical details, because every minute of attention can save a life. Information saves lives, and this information could save yours or that of someone you love. Watch until the end and share this video with someone who needs to understand this important warning. Now, take a deep breath and let's get straight to the point. Which are the 5 areas of the body where an itch should never be ignored? The answer starts right now. First area, itchy back. The first area that deserves your attention when it starts to itch for no apparent reason is the back, especially the area between the shoulder blades. Although many people associate an itchy back with dry skin or allergies, in older adults this can be an important warning sign. Medical studies have shown that a persistent itch in this area can be linked to Hodgkin's lymphoma, a type of cancer that affects the lymphatic system. In these cases, the itch doesn't go away with moisturizers and isn't related to a change of soap or clothing. It's an internal, constant itch that can be so irritating it disrupts sleep and daily activities. Often, it doesn't come with redness or visible marks, but those who experience it describe it as a deep, nagging discomfort under the skin. If you or someone you love has noticed this kind of itch, especially in the upper or middle back, lasting more than 2 or 3 weeks with no clear cause, it's vital to seek medical attention. Simple exams like blood tests and ultrasounds can spot early changes in the lymphatic system, making early diagnosis and successful treatment much more likely. An unexplained, persistent itch on the back is not just a coincidence or a temporary discomfort. It's your body trying to send a warning, one you should never ignore. Take it seriously and seek medical help as soon as possible. Your health and well-being are too precious to wait. If you've watched this far, hit the like button and comment with the number 1 to let us know you're following along. It really helps us a lot. Second area, itchy legs and ankles. The second area worth highlighting is the legs and ankles, especially when the itch doesn't go away and has no clear cause. Although most people associate leg itchiness with insect bites, allergies, or dry skin, in older adults, this persistent sensation can be a sign of something more serious. Studies have shown that a constant itch on the legs and around the ankles can be a warning sign of liver or bile duct cancer. In these cases, the disease disrupts the normal flow of bile, causing toxins to build up in the blood and irritate the skin from within. Often, there's no visible redness or open wounds, but those experiencing it describe it as an internal, nagging itch. That's nearly impossible to relieve. If this itch in the legs doesn't go away after 2 or 3 weeks and doesn't seem related to allergies or bug bites, it's crucial to seek medical attention. Simple blood and imaging tests can help detect early changes in the liver or bile ducts, significantly increasing the chance of successful treatment. An unexplained, persistent itch on the legs and ankles should never be dismissed as a mere skin irritation. It can be an important warning sign from your body, one that deserves your attention. Take care of yourself and listen to the signals your body is sending. Sometimes a simple itch can reveal a much bigger problem. If this information is helpful and makes sense to you, hit the like button and comment with the number 2 to show that you're following along. It really helps and inspires more videos. For those who want to age with health and quality of life. Third area, itchy armpits. The third area you should never ignore is the armpits. Although many people associate armpit itchiness with deodorant, sweat, or mild allergic reactions in older adults, and when it has no clear cause, this discomfort can indicate something more serious. Studies have warned that persistent itchiness in the armpits can be linked to changes in the lymph nodes, especially in cases of non-Hodgkin's lymphoma or breast cancer. In these situations, the itch doesn't go away with a change of deodorant or the use of anti-allergy creams, and it doesn't present any visible redness. It's an internal, constant sensation, as if the discomfort were coming from deep under the skin. If this itch lasts longer than 2 or 3 weeks and has no obvious explanation, it's vital to seek medical attention. A doctor can assess for swelling, lumps, or changes in the lymph nodes or breast tissue. Simple exams like ultrasounds or a physical examination can detect early changes and greatly increase the chances of successful treatment. Itchy armpits aren't just a minor skin issue when the sensation persists and doesn't go away. They can be an important signal that your body is fighting a more serious disease. That's why you should never wait too long to investigate. Your health and future deserve the attention required to act at the right time. If this information was valuable and makes sense to you, and you want to age with quality and take better care of your health, hit the like button and comment with the number 3 to show you're following along. Your interaction really helps and inspires more videos for those who want to live longer and better. Fourth area, itchy neck and clavicles. The fourth area that should never be ignored when it starts itching for no apparent reason is the neck and clavicle region. Although many people associate itchiness in this area with sensitivity to perfumes, jewelry, or simple irritation from clothing collars, in older adults and without a clear cause, this itch can indicate something much more serious. Studies show that persistent itching on the neck and near the clavicles can signal changes in the fibula lymph nodes of this region, especially linked to cancers such as Hodgkin's lymphoma or thyroid cancer. In these cases, especially linked to cancers such as Hodgkin's lymphoma or thyroid cancer. In these cases, The itch doesn't go away with moisturizers or allergy creams and doesn't present visible redness, but it can persist for weeks or even months, causing an irritating and hard-to-relieve sensation. If this itch lasts more than 2 or 3 weeks and has no clear explanation, seek medical attention to check for changes in the lymph nodes or tissues in this area. Simple exams, such as ultrasounds and blood tests, can detect early changes, increasing the chances of successful treatment. Itchy neck and clavicles should never be considered just a minor irritation. When persistent and unexplained, it's an important warning from your body that shouldn't be ignored. Take care of yourself and pay attention to the signals your body shows. Sometimes, a simple itch can represent a silent internal battle. If this information was clear and helpful to you, hit the like button and comment with the number 4 to show you're following along. Your interaction really helps and inspires more videos for those who want to age with health and quality of life. 5th area, itchy scalp and head. The last area that deserves special attention is the scalp and head region. Although many people think itchiness in this area is just dandruff or dry skin, in older adults, a persistent itch can indicate something more serious, such as skin cancer, including basal cell carcinoma or melanoma, which may initially manifest as a localized itch. These types of skin cancers often appear on sun-exposed areas, like the scalp, especially in people who have spent a lot of time in the sun without proper protection. The itch may be accompanied by small sores that don't heal, spots, or changes in the texture of the skin. If this itch lasts more than 2 or 3 weeks and you notice any changes on your skin, it's essential to see a dermatologist as soon as possible. Early diagnosis of skin cancer can save lives and prevent invasive and painful treatments. Don't underestimate persistent itchiness on your head and scalp. Your body may be trying to alert you to something that requires immediate attention. If you found this information important and want to keep learning how to take better care of your health, hit the like button and comment with the number 5 to show you followed along till the end. Your engagement helps us bring more content that can make a difference in the lives of those who want to age with quality and well-being. Now that you know the 5 areas of the body where a persistent itch can be a serious warning sign, especially for older adults, it's crucial never to ignore these signals. Remember, itches that don't go away, have no clear explanation, and appear in these specific areas may be symptoms of cancer or other serious illnesses. So take care of yourself and your loved ones. If you notice any of these signs, seek medical attention as soon as possible. Early diagnosis saves lives. If this video was helpful to you, like, share it with your friends and family, and subscribe to the channel for more important content about health and quality of life for seniors. Don't forget to comment with the number of the area that caught your attention the most, from 1 to 5. This really helps our channel and motivates us to create more life-changing videos. Thank you very much for watching until the end. Take good care of yourself and see you in the next video.